Hi, I'm Dr. Dutta. I'm a cosmetic surgeon at the Aesthetic Beauty Center. Chemical peel has been available for a long time. Almost 2,000 or 3,000 years ago, Cleopatra used to use fermented donkey's milk to cleanse her skin. Now that's a very mild form of lactic acid which used to work on the skin and makes the skin look fresher, and some people say it glows. However, in the modern day and age, we use a little bit more scientific chemicals that are available, like trichloroacetic acid, the glycolic acid, and of course the deepest ones that we do are the phenol peels or exoderm. The peel is used to remove the top layer and help the skin to get tighter, and of course it also helps to produce more collagen, and that makes the skin softer. The chemical peels are by and large used for removing fine lines and wrinkles, tightening the skin, making the feel of the skin change. So it changes the texture of the skin and it softens the skin. But also some of the deeper peels can be used to remove or reduce the appearance of acne scars, and the deeper pigmentation or the hyperpigmentation cannot be treated by acid peels, but the superficial pigmentations can easily be treated with the chemical peels. Like any other medical or non-medical treatments, chemical peels can cause side effects. The lighter peels tend not to cause too much side effects because they are not going deeper into the skin. However, the moderate depth or the full thickness peels are notorious in causing various side effects. One of the common problems we find is we are removing the top layers of the skin with the peel, and hence the UV exposure or the sun exposure must be kept to a minimum because the damage that can cause to the skin is substantial. The other side effects which are not so common are redness, scarring, of course high color or low color to the skin. We call it hyper or hypopigmentation. These are not so common with the mild or moderate peels, but much more common with the deeper peels. The deepest peel we do is called exoderm. It is a phenol peel mixed with various other chemicals that controls the penetration of the acid. If we look at the skin has got various layers. The pink bit at the top is the epidermis. On the face, the epidermis is only 1/4 of a millimeter deep. And then the purple bit, which is the dermis. Now in the deep peels, we are going halfway into the dermis. That means virtually most of the top layer of the skin and also the deeper layer of the skin is removed, leaving only a tiny bit of cells here and the cells that go around the hair follicles, and the new skin is regenerated from that. So the downtime is anything between 12 to 14 days, sometimes even longer. Recovery is also quite extensive because the patients look scabby, they look pretty red, but the effect that it produces, the tightness of the skin that it produces is significantly more, and the freshness is long lasting. Some people say that their skin looks so much fresher, so much softer for years to come, anything between 7 to 10 years. The commonest peel that we do is the TCA or the trichloroacetic acid peel. It has got a huge advantage. You can get it in various strengths, anything from 12% to 20%. It goes up to 80%. So depending on how deep we want to go into the skin, we can choose the concentration. We can also lay multiple layers on the skin so that the skin penetration can be controlled by the doctor. I think the best advantage of the trichloroacetic acid peel is that we can neutralize it, and hence the pain and the symptoms are controlled immediately after the treatment is complete. Of course, as the peeling happens over the next few days, the patient may find it comfortable to stay off for a couple of days, but most often the lighter TCA peels, the patient can go back to work the next day.